Hello, Dr. Crockett and Dr. Crocker with Zeal Integrated Health, and today we want to talk about the early signs that might indicate you're developing type 2 diabetes. A lot of times, people start, having issues that are warning signs. It could be something as simple as frequent urination. You're running to the restroom over and over and over, or you're constantly thirsty. You just can't get enough water or hydration in your body. Yep. Some of these things are the things that should alert you to go get some blood work ran. But there's other things in this list that should kind of set off a warning sign indicating that you need some testing done. So let's run through some of these things. It could be just, a lack of energy. A lot of times if you're not processing sugars, you're going to run into a lack of energy. Yep. That's your fuel source. And so you just get fatigued earlier in the day, or you seem like you're napping more often throughout the day would be a factor with that.
Yeah, another one is, you see a lot of times patients will say, or even people say, I have low blood sugar, so I don't really have a risk of developing diabetes. My sugars are low. Well, actually what's happening is you're more than likely you're getting that up and down bounce in your blood sugars. And when you don't have that regularity in your sugars, you're putting yourself at an increased risk for developing more complications and obviously getting diabetes after that. So that's one of the big ones we see a lot.
Yeah, and obviously with low blood sugar, that's when most people get hangry. You've heard that term, hungry and angry. Yep. The Betty White commercials, the Snickers commercials come to mind when I think about that. But people, when their blood sugar gets low, their brain doesn't function like it should. And that's when that hangry attitude comes into, and I can always tell when my kids, they need fed, right? Of course, maybe I'm the same way. Maybe they get it from me. I don't know. But that's something. So people get irritable. Yeah. They get, their mood starts to change. You'll even see people dealing with depression with some of these things as well.
Yeah. So you see the depression side of things quite often. You say, well, they wonder, is it something wrong with me? And they go to their doctor, and it's really nothing that they can find that's wrong with them, and it's usually an issue in the gut. You've got gut issues, you've got food sensitivities, you've got irregularities in blood sugars that leads into more of this type of situation.
Yeah. Now, some of the more severe things that happen as sugars get out of control, it really starts to affect maybe vision. Yep. So we have people come in that say, I found out I was diabetic because all of a sudden I started getting blurry vision. I went to the eye doctor and they're telling me, hey, you need to go get your sugars tested. Yep. They're seeing diabetic signs in their eyes. You also see things affecting hands and feet.
Yeah,
right?
You see things like where your feet start to tingle. You think, well, why is it tingling? Am I getting lack of blood flow there, or what's causing that? And you see that sometimes you'll even notice when it gets to a very extended point, they'll have lack of balance. So their balance will be affected from potentially the neuropathy that they're starting to get. And that's where it leads into you start to eventually can lose limbs from this situation. So it can get very serious.
And then you also see a lot of infections. As sugars go up, your body has some natural ways to eliminate the sugar from the body, so it will dump it into the urine. So you see urinary tract infections. Yep. So again, lots of clients come in and they say, I was going to the doctor month after month dealing with these chronic UTIs, and they just kept giving them antibiotics and not testing their blood sugar. So make sure if you're dealing with this reoccurring infection like that you're getting your blood sugars tested and looking for the causes. The other factor, healing. Yeah. When blood sugars are high, what's it do to healing?
Your healing very slows down. I mean, you end up with situations where you're especially at the bottoms of the leg, bottoms of the feet, you'll see people come in all the time and they'll say, well, I just had this little bitty cut and it just never healed and it just keeps getting bigger and bigger and bigger. That's a huge sign that you need to get your blood sugars checked.
So this is just a list of things to be checking for. This is a disease that's affecting, there's a study that UCLA just put out, I think maybe 2016-17, but it found that over 50% of households in California were dealing with pre-diabetes or diabetes. And what they found is that only maybe 10-11% of those pre-diabetics actually know that they have pre-diabetes. So if you're having these symptoms, I encourage you to get checked and check out our channel, and hopefully you'll learn more about diabetes and how to prevent these kinds of things.